Hello, my name is Joe Murray. I'm a gastroenterologist at the Mayo Clinic in Rochester, Minnesota in the Celiac Disease Program. And here with me is my colleague.
My name is Jackie See. I'm a dietitian at Mayo Clinic in gastroenterology.
And Jackie and I are here now because of some recent buzz, let's say, or issues raised about the appropriateness and safety of oats for patients with celiac disease. Jackie, do you want to review what's known about oats for patients with celiac disease?
Well, in the past it was thought that gluten or oats were toxic to the intestine of people with celiac disease. And later it was decided that oats themselves are gluten-free, but often they're contaminated in the field or factory by other grains which contain gluten. There's been extensive research done in both adults and children, and it's been shown conclusively that gluten-free oats are safe for most people with celiac disease.
Okay. There's been this recent report from the North American Society for the Study of Celiac Disease that really tried to bring out what's known about what's called commercially sourced oats versus oats that maybe were purity protocol grown or something of that ilk. Can you explain what's going on?
Well, the purity protocol was used in the past, and what that involved was the oats were grown in dedicated fields, and they were processed, transported, and packaged in dedicated gluten-free facilities so that the gluten content was less than 20 parts per million, which is the definition of gluten-free. But lately, due to the inability of the purity protocol farmers to keep up with the demand for gluten-free oats, some companies such as Bob's Red Mill, Quaker, and General Mills have started cleaning their own oats. For example, General Mills, in order to make gluten-free Cheerios, has built an 8-story facility, and they use a several-stage process to remove gluten contaminants from oats, such as barley, wheat, and other contaminants. And so the final product contains less than 20 parts per million. The final product is also shipped in dedicated vehicles to other facilities for packaging and distribution. So your chance of getting gluten contamination from products like that are essentially nil. It's like winning the lottery.
Yeah. So Jackie, tell me about testing. So some of these, at least what we've seen is, at least some of these companies have been doing testing. Do you want to talk about any examples of what you're seeing with regard to the type of testing that's done to at least ensure as much as possible that these are truly below that threshold? What type of testing is done on, maybe the flour or the end products, and can you discuss an example?
Okay, they start with mechanical sorting of other grains. First they do it by hand, and then they have a mechanical sorter that sorts grains based on their size and shape. They also test the flour after it's milled, and then they test the final product 24 times to make sure every product, every package that leaves the plant is gluten-free.
Good. So tell me, some people react to what are apparently gluten-free oats, or have reported reactions. Do you want to describe why you think that might be?
Well, a very small percentage of patients may have an immune response to avenin, which is a protein similar to gluten, but this is very, very rare. More commonly, people might react to the fiber content of oats. If you're not used to eating a high-fiber diet, introducing oats too rapidly can cause gas, bloating, and diarrhea. Some people may be intolerant to the fermentable carbohydrates in oats. In other words, certain carbohydrates don't digest completely. They reach the colon, start to ferment, and cause gas, bloating, and diarrhea. Some people may have a nocebo effect. This is similar to the placebo effect used in studies, and what it boils down to is you have a reaction because you think you're supposed to have a reaction.
So Jackie, tell me what you recommend then to a patient if they say, gosh, I tried these gluten-free oats and I've really felt unwell or something happened, what do you suggest they do?
Well, well, first of all, I would introduce oats gradually to minimize the side effects. Maybe start with a smaller amount, and if you have the symptoms repeatedly, probably stop eating oats. If you think it's due to contamination, you should contact the Food and Drug Administration, FDA MedWatch, and also save the packaging so they can track down the source of contamination.
How should tell me about what the health benefits of oats in general are?
Oh, oats have many benefits for the gluten-free diet. Oats are a whole grain, which are difficult to find in a gluten-free diet. The dietary guidelines for Americans recommend that we eat half of our grains should be whole grains, or at least 3 servings a day. Oats contain a lot of nutrients that are lacking in the gluten-free diet, such as fiber, iron, B vitamins. They're a particularly good source of soluble fiber, which reduces your risk of heart disease.
Excellent. And how should patients select their gluten-free oat products?
Well, first of all, it's a good idea to discuss it with your physician or dietitian before deciding if you should introduce oats into your diet. We generally recommend our patients wait a year after diagnosis to allow their intestine to heal. When shopping for gluten-free oats, there are a lot of gluten-free sounding oats out there, like Irish oats, steel-cut oats, organic oats. These are not necessarily gluten-free unless the label says gluten-free, so be sure that the label says gluten-free.
Okay. Well, Jackie, thank you for the discussion. I think it seems that there is, I think, I won't say just new hope, but new opportunities for patients with celiac disease to expand their diet to an area perhaps in the past they either felt uncomfortable doing so or we've actively recommended not to include oats. So thank you.